You're on Columbia's hottest podcast, Here for the Health of It podcast. I'm Dr. Randy, here with Dr. Tom, and we have our first ever veterinarian. And let me tell you how this started, because we had the wiener dog walker on. Do you know Anna?
Wiener dog walker.
Yeah, she's okay. So she organized this huge thing where she takes, I think it's 60 wiener dogs, all go out on a walk, and they just walk, and they wiener dogs can't walk that far, so they all have carriages and wagons and strollers and all kinds of stuff, and it's
Real legs are large.
yeah, like long legs and wiener dogs. And I was asking her all these questions. We started talking about wiener dogs, and she started talking about their health issues, so I started asking her questions. And then basically she was like, quit asking me these questions. You need to have a veterinarian on here because I don't know any of them. She just organized a dog walk, but we were asking her animal questions. So I'm excited to ask you some questions.
Let's go.
And so here's where I want to start, because I've been dying to know this answer for a long time. You know what question I'm going to ask.
You going right into neutering?
I think
out
I
of
have
the
to,
gates,
right?
Oh my goodness!
Is it too early for that?
No.
All right. Well, first, tell us who you are. Tell us where your clinic is. All that stuff. Tell us what you do.
All right. So my name is Loures Rivera, and I am a small animal veterinarian. So why I say small animals? Because there's large animal, there's small animal, there's exotic, there's wildlife, there's ramifications of it. Mm-hmm. So then, currently I am a relief veterinarian, which means that I travel to different clinics that will need help. Meaning I can be tomorrow in Charleston. I can be
That's
in
cool.
Charlotte, Columbia,
That is cool.
Sumter, Newberry, you name it.
Do you have to stay in South Carolina?
Yes, because
License-wise?
I'm licensed just in South Carolina. If I get a license in North Carolina, then I will be able to.
Okay.
Yeah, that kind of thing.
And how many days a week are you usually doing it? Like, are people calling like crazy?
No, that is something that I will have to have it set up. So, it's like a schedule. It's not out of the blue. Although there's some that will call out of the blue.
Mm-hmm.
Yes. Sure. Like, let's say a doctor got sick or have an emergency. Hey, can you cover up today? And if I'm available, yes.
Yeah, nice.
Yeah.
So you walk into a lot of random clinics then, right?
Yes. Different
Don't really know where
staff,
stuff
different
is.
demographic, how they work, what is the rhythm, things like that.
It's intense.
So
And
it's
some of them
just-
are probably just a mess. I mean, I'm sure some of them are immaculate and some of them are just cluttered.
You can encounter a little bit of everything, I guess. It's kind of like, I see it kind of like going to another country. So it's not like saying, such country is beautiful, but don't go to this one because there's so much crime and there's so much this and that. Mm-hmm. You have good and bad and somewhere in the middle of, I think, in any profession.
Yeah.
So.
And some areas you go to, you're probably thinking to yourself, all right, there's going to be 90% pit bulls in this area, and there's going to be 90% wiener dogs in this area.
Not necessarily.
Okay.
No, I will not go. I have never gone to an area thinking of, I will have more of this breed than the other
Really?
breed. No, it will be more in regards to what services are provided, how much the clients can afford for the pet of their, the care of their pet, more than anything else. A lot of client education to like something very simple. Do you guys have pets?
Nope.
Not anymore.
I had a fish for a while.
Oh, okay. I mean, dogs
didn't
or
make it.
cat. Let's
I have
just keep it
chickens.
to dogs. Okay.
Are chickens a small animal?
No,
Okay.
they're not considered. But a lot of small animal vets could and can do chickens.
Chickens.
But I did have a Boston Terrier for
Yes.
9 years.
So a big thing in dogs and cats is heartworm prevention, right? Because a mosquito transfers these disease, this type of worm that goes directly to the heart. I mean, there's a pathway and there's a travel. It gets to the heart and it stays there. And the damage is very significant.
Yeah.
A lot of people believe and don't know about that you have to keep your pet on prevention as soon as 8 weeks of age until the day that it goes to heaven.
What is prevention for heartworms?
So there's different, there's like different
Like eating bananas?
No, it is a pharmaceutical, and it is a type of medication that will prevent that worm from replicating or from living in the system.
Gotcha. Is there anything natural? Like dogs used to be wolves, correct? Is that the right lineage?
There is a lineage there, but it's not
Not kind
that they were wolves.
Yeah. Because I always think like, well, what did the wolves do back in the day? Did they eat like tree bark, or was there some plant that they could eat and prevent the worms?
Well, it's just like if you think about it, it's like any other diseases. Kind of like, well, but I don't know. Let's take, for example, tuberculosis. I mean, we have it now, but back in how many years ago we didn't have it?
Right.
So do I have the answer in terms of did mosquitoes
Was there-
and
yeah.
heartworms have been or have existed for 100 years,
Right.
50 years, whatever the amount of years is? I don't have the answer to
And is
that,
there
but
s-
it could be.
Is there something about the heart that the worm loves? Like, why does it go there?
It goes specifically to an area that is the pulmonary artery.
Yeah.
And it just lodged there. The environment is just, let's say, is the perfect environment for them. They create a lot of damage. And just overall, let's say, within a month, the damage is very significant. Very significant. Difference between dogs and cats, dogs can have 1, 10, 20 worms and have no clinical symptoms. And a cat can have one worm, that's enough to be very
Sayonara.
detrimental for that cat.
No kidding.
I wonder if wolves just died faster too. Like
yeah, was
if
the
they're just
lifespan-
replicating like crazy and only living
And the
for 6
lifespan
months or a
was-
year at a time.
Now, we cut you off. You said you travel,
Yeah.
and I think there was one other thing you were going to say. Or no?
No, I
No?
don't think so.
Oh, okay, good. We didn't. I thought we
I
like
would
to
never
butt
cut
in.
you off, Tom.
No.
Sometime.
He always does.
No, right.
So you said until your animal goes to heaven, from the time they're born until they go to
Yes.
heaven. So I want to know if you think animals go to heaven, and if all animals or just some.
We asked a pastor this.
What did he said?
Well, he had kind of like a pastory answer. Like
Yeah, it
he
was
said,
too
he said this. He
political.
said this. I'll tell you this. Once you're in heaven, it's going to be so good you won't even care, or something like that. Like,
But does everybody goes to heaven?
well, that's the thing. He just didn't answer. He's like, well, once you're there, you're not. It's so great in heaven that you're not. It's not going to matter.
Yes, and I've also heard. I'm just glad it's not my decision to have to make.
Correct. Well, then I think the same will apply to animals.
You don't want to answer it directly. You just
No.
want to throw out a political or a politician answer.
Correct.
Fair enough.
I'll stay there.
But there are some dogs out there that are just pains in the ass, right?
Yeah. What dog? If
There
there was
is-
one dog
there
that's
is-
not going to heaven, which
Yeah.
dog
There
would it
is
be?
good dogs. Let's put it this way. There's good animals and there's bad animals.
Yep.
Can we say the same about people? We know there's good people and there's
good.
not good people out there. That's reality. However, I will say that that stereotype that, oh my God, all pit bulls are bad. How many times we have heard that,
Yep.
right?
Randy hates them.
That's just
He's scared of them, I think.
that's just
I am
not
scared.
true.
I saw when I was younger a pit bull
Mm-hmm.
latch onto my dog's throat, and she had a really thick leather collar that it like slipped, so it was just locked onto the
Uh-huh.
leather piece. But my dad was like beating it in the head with a stick, and it still wouldn't let go.
Yeah.
So I don't think that all pit bulls are bad. In fact, I think probably a tiny minority of pit bulls are bad, but they're so strong
They are.
that if there is a bad one, it does so much more damage. Like I'm sure
could.
there's bad Yorkies out there, but a bad Yorkie is not going to send me to the hospital. But a bad pit bull terrifies me.
Still, Yorkie or a Chihuahua can send you to the hospital with a nasty bite.
Not me. I'm way too tough for that.
He's so fast, too.
A
His
Yorkie wouldn't even
reflexes-
get close to me.
His
got
reflexes
it
are
under control.
remarkable.
See how fast I can run.
But I'll tell you this. So if I go in an exam room and you bring your pit bull and you bring your Yorkie,
Yep.
no, let's say Chihuahua.
Now, why did you
I
choose
think
that?
the way that you said that, I think is perfect.
I feel like I'm bringing the pit bull and he's got the little Yorkie. But go on.
She said Yorkie to you and then changed to Chihuahua.
Go on. Let's
So
make the point.
you bring the Chihuahua, you bring the pit bull. I will be more cautious with your Chihuahua than
Really?
the pit bull.
Now, do you base it on the human? Like, is there a lot of, like, you see the human and you go,
I see the interaction
Yeah.
within or among the owner and the dog.
right.
That's a big one. We have heard that, for example, with children, like if you are you don't project like that everything is okay, is safe. Let's say at the doctor's office, and everything is going to be fine. Shots don't hurt, or it's just something small. It will go away. It's the same thing
Yeah.
with pet and owner situation. But there's many times that the owners are completely oblivious about
Yeah.
the actual behavior of their dog.
So what makes you more cautious going into the Chihuahua? Just
So, for example, if I see that the Chihuahua is always being held like a baby,
Yeah.
kind of like that, and they're already like, it's going to be okay, no problem, and everything. And as soon as you try to approach, I have learned after the years of being a vet for 16 years, you don't just go and reach the pet from the arms.
right.
You don't do. Could you please come over here, place him on the table, examination table, or could you hand him or her to me backwards, butt first, instead of head first? That seems to work, and you go from there. Whatever you, yes, you will be able to tell within just few, not even the first 2 minutes, let's say, you have an idea how is it gonna go.
Yeah.
And you have your technician there helping to keep everything under control and to restrain the pet in a proper and safe manner for everybody, for the pet, for me, for
Yeah.
the technician, all of that.
How often are you getting just mauled?
Yeah.
Or
How many
injured
bites?
or scratched?
Never.
No.
I have
What?
I have never.
Nope.
I have never been bitten.
No.
I have been once kicked by a miniature horse.
Ooh. Dang.
They are naughty.
Are they
naughty.
considered small animals?
No.
Or this was just
But
a
I
different...
used to be a large animal vet, and
Gotcha.
when I moved to Colombia, then I had to stop because a single mom doing large animal, that doesn't work.
Yeah. Is that because you have to travel to all
You
the...
have to travel.
I
There's
see.
a lot of on calls, and it's not like, okay, I got a phone call, an emergency at 2:00. Let's go to the farm. Oh yeah, let's get in the car and
Right.
go. That's not the case. So that happened. But in terms of
being attacked?
right being, so when I'm working, like I said, I spend my time seeing the scenario, seeing what is the situation there. And I always want my technician to be safe, myself to be safe, and determine how we're going to approach this. Is it we're going to do everything in front here of the owner, or sometimes dogs behave like that because they're being protective of their owners. So we just have to take them away from that situation. For example, go in the treatment area and perform the exam and take all the, let's say, different samples that we might need for diagnostics, and then proceed from there. And many dogs do much better. Sometimes just to put a muzzle on. Muzzle is not only that it will not bite, but it also provides a distraction. The dog is now paying attention. What do I have here?
Yeah.
Instead of, like, for example, me checking his hips and his knees or taking a blood sample. Wow. So that works.
So when you have a dog owner and a cat owner come in, is there any differences between them that you notice?
Both can show that they are more attached to their pets or very careful of, okay, what are you going to do? And what vaccines are being done today? And very specific. But I see the same in both.
Who's more specific? Like, because when I meet, and especially younger, I work with a lot of like 30-something-year-old women, and they all refer to their dogs as their kids.
Yes.
Or they you know, my fur baby, or my parents have a grand fur baby, or
four-legged kid.
Yes, and they're just so over the top with this dog is my baby, and then they have a real baby, and then they realize, oh wait, it's actually a dog now, and they don't even bring it up anymore.
Which one is
it's like they forgot they had the dog. But I just see, you know, especially in the 25 to 35-year-old age range, when they come in, they would be like, all right, here, I typed out a whole routine of what they do. This is when they like to wake up. This is when they like to go to bed. They only had 2 30-minute naps today, like that kind of thing. Versus, let's say that's, you know, it's a family pet and they have 4 animals. They're like, hey, here's the dog. Can you take a look at him and see if there's anything wrong?
Actually, you will be surprised. There's some people that have 4 or 5 dogs and they still know exactly what's going on with all 4 or 5, plus children.
Wow.
Yes. So there are some intense ones out there. I will tell you this. You came in with your pit bull, and I will be always Mr. So-and-so. And depending on the demographics, more than anything, I will be then like, okay, mom. And I will refer to the
dad.
owner as mom or dad a lot.
So you play right into it.
Because, yes, they consider it, and it is true. It's part of the family. I understand. Yes.
Yeah.
But they have that.
Yeah.
Now, if a single male shows up with a cat, is that a red flag? Like, are you reporting that guy to the board? Or what do you do?
All right. We can say
What do you
anything
do?
here, right?
That's right.
We can't bait you into all kinds of stuff here.
Okay. So, I'm a single mom.
Yes, this is perfect.
All right. So,
Got to be one of your first questions when you're out.
when, being out there and dating, right?
Yes.
You see a lot. Here's the thing. Either someone told me or I read it somewhere that, please, no offense to any guys out there, this is something that was brought up to me and I was like, what? Is that real?
No, they need to hear this.
That a single man that owns a cat, it is a red flag. And I was like,
If there's
what?
anything more than a red flag, that would be it.
Yes, and I was like, what is this?
No, it's a good.
And what if they gave it a human name like Paul or something?
Oh, there's many that have human. Yes, Grace.
Yeah.
The other, Sir, this and this.
yeah,
Oh,
yeah.
yeah, Sir. And some people will get offended if you, let's say, is Sir, I don't know, Tom. Sir Tom. No, it's Sir Tom.
Sir Tom.
Yes.
I think you've
they
actually been thinking about
they
going by
correct
that
you.
yourself.
I do like that.
But back to a man with single man.
Yeah, let's get back to
With
your
a
dating
cat.
life quick.
Yeah.
Oh my God, no.
I mean, but you got to ask it early in the day. Like,
Yeah, when does that
Date
come
one.
up? You ask them what kind of animals they have via text?
yeah.
Oh my God. Let me finish my
Okay,
story.
go ahead.
So when I learned about that, I was like, that's not true. What do you mean a red flag?
Right.
So what does everybody now these days do? Let me Google it.
Yep.
And in Google, it says that males that own a cat, their personality and their attachment to their cat is different. That's it. You guys can Google it.
Yeah.
That's your homework.
Okay.
But I was like, and I have to say, I met at least 2 that own a cat, and they were a little bit different.
Yeah.
I was
Yes,
like,
to
okay,
say the
it's a
least.
good day. Nice to meet you. But
Yep.
bye.
Good.
Wish
Nope.
you the best.
No more dates after that. Tell the audience about the different specialties within being a vet, because Anna also said, I think her wiener dog had a cardiologist.
Yes.
That's
exactly.
a thing.
Yes. So just like humans can be a general practitioner, right? Veterinarians, I'm a general practitioner.
Yeah.
Although I did have more than just the graduating from vet school, I also have an internship after that, which is a year that you specialize on what you wanted to do. For example, mine was equine, which is just dealing with horses. I did that for 15 months after vet school. So when you go to vet school, you kind of get the idea, maybe you already have the idea what you're going to do, right? Maybe not. But those are those 4 years that you will kind of like, okay, where I'm going, right? And you will decide what would you like to do, general practitioner, or if you want to specialize. Just like in people, cardiologists, ophthalmologists, internal medicine,
Right.
Dermatology, oncology.
Are there dermatologists for dogs?
Yes,
There
and we
is.
have all of that here in Columbia.
No way.
It's just miles away.
It's got to be like are they pretty nichey then, right? Like we probably have one dermatologist in all of Columbia for dogs?
For example, we have one neurologist here in Columbia, and he is one of few
Yeah.
within, and I should not say few, but a small number within even the nation. So, yeah, you have all of that. So you do vet school 4 years, then you do an internship 1 year, although you could do more than one. And then you have to do a residency program, which is 3 years. And just like a human, you have to pass your boards. And then you will become a
Right.
board certified internal medicine cardiologist.
Which
whatever.
are there any non-board certified docs? Like you can't be one, right? It's always funny to me. It's like, hey, I'm a board certified chiropractor. It's like, well, you can't practice unless you're board certified.
Well,
Like I'd love to say that I wasn't and see what that would get me. Because that would be, I feel like it's a niche.
for example, I cannot say, like, for example, I like the heart a lot in the GI,
Yeah.
but I cannot say I'm a cardiologist.
Right.
I don't have that training.
It's only for specialties then. So you would say
Exactly.
board certified for
It's
your
a
specialty.
specialty.
Okay.
If not, you are just a DVM, which is doctor in veterinary medicine. But the ones accredited have another one, depending on the accreditation.
Okay.
So to become a vet, you have to do your undergrad stuff. Because I remember being an undergrad and being with the dentist and the medical doctors and the veterinarians. And then once you do that, so you probably generally get a Bachelor of Science or something
You
close
can
to that.
do a bachelor's degree, or you can just go and get your pre-requirements in order to get to vet
nice.
school.
Yeah.
So it's not that you have to have a 4-year degree.
Got it.
You
And then when you
don't.
go to a school, they're hard to get into, I'm told.
They are hard.
Very hard to get
and
into.
expensive to apply too.
Is it? And I think there's only maybe one in South Carolina, one
There's
school.
none right now.
Zero right now? They're
So,
getting one in Clemson.
Yes, there's one getting, in the process of building and everything. The expectation is fall of 2026, I believe. So 3 years, that's around the
Right.
corner.
Yeah.
Clemson, yes, which I think is amazing. I think
That's
it's
cool.
about time.
How many schools are in the country?
Oh my goodness.
Like, is it less than 20?
But, no, it's
Okay.
not. And there's some newer ones meaning within the last 10 years
Yeah.
or so. There's some abroad that are still, like, for example, I went to Ross University. Ross University,
Okay.
ROSS. This is a private veterinary school, but it is located in St. Kitts and Nevis in the Caribbean.
What? That's
So
where
I
I
was
would
there 3 years, and it's by trimester, not semester.
go. That's how ours was.
Yep.
So therefore, it's faster pace.
So you can do
Like
3 a year
Yes.
instead of 2 a year.
Yep.
it's way faster. So basically, I finished vet school in like 3 years and some change,
Yep.
right? But then my clinical year, I did at University of Florida because, I mean, St. Kitts and Nevis is you can go around the island in an hour and 20 minutes.
Really?
That's it. So it's very small, so you don't have the caseload.
It's not touristy, is it? Like I've never.
Is.
Oh, it is.
It is. It's very much so. A lot. I remember one time being at the beach, and there was this yacht,
Yeah.
anchor there, and it has the helicopter pad
Yep.
and everything. And it turned out it was somebody from Australia, like mega wealthy and everything.
Yeah.
Like a lot of actresses. I'm sorry. A lot of
Celebrities head that way.
celebrities.
Yeah.
Oh yeah.
That's sweet.
A lot.
I think St. Kitts is because it's not in the U.S., right? It's its
Correct.
own country, I think.
It's a Commonwealth, I believe, of
Yes.
United Kingdom.
And I think it's a hot spot for people who want to get a second passport.
Really?
Yeah. When I was reading about, I just reading
fleeing
books
the
now,
country,
just-
like being able
just
to.
about how to get multiple passports. But they were talking about how you can go to St. Kitts, and it's one of the easiest places to get a second
Really?
passport from. Yeah.
I didn't know that.
He sits in his bunker with his canned food. And reads about it.
I was reading a book. It's called Neil Strauss. It's called Emergency, but it was a prep. It was kind of like a prepper, like how much food you should have ready, and if the Wi-Fi goes out, what does that look like? All those things. But he was talking about like having multiple passports in multiple places. But St. Kitts was a hot one on there.
Never knew that.
No, okay.
All right.
But,
All right, so-
it was an
side note.
experience. I will not change it for anything. It was a great experience.
Is that the best school?
The culture.
Do they rank vet schools?
Right. I'm curious about.
They do rank.
Okay.
And tell me how you feel about this. If a person comes to you,
Yep.
I'm your patient,
Yep.
and then it's like, but where did you graduate from?
Right.
And it's like, why does that matter?
Exactly.
Why does that matter?
Yeah.
So do I'm a less of a vet because I came from Ross than I graduate from LSU?
I could care less about school. I think
So-
I think a lot of school's a waste.
In
Let
the
me
in the
tell you-
chiropractic world, it's different though.
Okay.
Because there's
Well, there's
different
different
techniques and different
philosophies.
ways of
There's
adjusting.
weird-
So you kind of know, like if someone went to Palmer, you kind of know when you walk in to get adjusted what you're going to get.
Okay.
Versus if they went to, let's say, like
New York
Cleveland
or
chiropractic or
Cleveland.
New
Okay.
York chiropractic would be
There's
very
like a
different.
completely different philosophical approach, and that's where some people do seek out schools. But there were dipshits in our school just like other ones. You know what I mean?
I wouldn't go to someone just because of their school, or not go to someone
Yeah.
just because
I
of their
got
school.
you.
Yeah.
Well, let me tell you a
Do
story.
people do that in the vet world?
Oh, yeah.
No way.
They have done it to me. Oh my God, I have stories.
Dang.
Really?
I have stories. And I'll tell you two. So one being a student at University of Florida. So it's a whole year in its clinical rotations. So for example, two weeks doing ophthalmology, which is a specialty as well. 2 weeks in cardiology, 2 weeks small animal medicine, 2 weeks large animal medicine, and so on. So I was in my rotation large animal, which is primarily horses, large animal medicine. And just like in a hospital, in the morning you do rounds. And I remember that the doctor, he asked me a question, and I was just like, I don't know the answer to that question. And he's like, didn't you read my notes? Weren't you in class? And I'm
Intense.
like, I'm so sorry. I was not in your class. I'm an offshore student, because that's how they call us, coming from
Offshore.
Ross, offshore students.
Yeah.
And he's like, okay. Then it turned out that he said to me, well, so where you went to school? Ross. Oh, you're a Rossie. And I'm like, yes, I am. I'm like, well, you guys are always better prepared than the students here anyhow.
Oh, nice.
And I'm like, so I felt really good.
Yeah.
I was like, okay.
You were getting ready to get
And
crushed.
I'm like, and then after that, believe me, I was ready for all his questions. I'm like, I'm not going to miss a question again if he asks me. So that happened. Then I have clients in terms of course, I have an accent. My first language is Spanish, born and raised in Puerto Rico. I have, when I was in a private practice here in Columbia, I was seeing let's say Mr. Smith, and came with his dog and everything. And I already have met his wife. Precious lady, like good, it was a very good relationship, but she was sick, so he brought the dog. All right. And he has his hat, veteran, Army veteran, and I was like, thank you for your service.
Yeah.
How, kind of like, how long were you in? Those kind of, just to have conversation. And I'm like, well, I want to take whatever, Fluffy, let's say Fluffy to the back to take blood. We're running this type of test, and this is why. And then I brought him back. I found this, so there's medication. We don't have it in the clinic, but I'm going to write a prescription for you to go and get it at any pharmacy that you want.
Yeah.
Okay. So I go out, and I'm typing my notes, and I'm writing the prescription, but I see that my technician is not coming out of the room, and I'm like, what is going on? So finally she comes out, and she's like, Rivera, you're not going to believe this. And I'm like, what? Well, I'm glad that you're sitting down. And I'm like, okay. So she said, you know what he told me? And I'm like, what? He was like, well, let's see how long it takes that doctor to write the prescription. Let's see if she takes too long and she knows how to spell things out.
Oh,
And I'm like, oh, really? Okay.
interesting.
I did all my notes. I finished the prescription. I went to the other appointment. I finished the appointment. And I'm like, okay, now I'm ready. So I go in, and I'm holding the prescription, and I'm like, Mr. Smith, I'm sorry. I was in, another very important appointment, but here's it is. Here's the prescription. But, it took me a little bit of time because I was making sure that I knew how to spell every single word and that everybody can understand me. He turned red, like even the ears.
Right.
Red. And I'm like, okay, you have a good day. All right, bye. It was just like, I'm
Jeez.
like, please, come on.
I love that.
I mean, I speak 2 languages. And you,
right.
how many?
Right.
I only speak one.
I only speak one.
I dabble in Spanish a little bit. Everybody knows that because of my skin tone.
Yeah, you could tell people that
I-
you speak 3 languages.
Sometimes
and they
people
would
think I'm.
believe
Yeah.
Yeah. Sometimes
You
people
look.
think I'm
You go
Spanish.
to Puerto Rico, and you will be
I fit right
like,
in.
yeah.
I'm a blender. I've noticed that. I feel like I can be French. My background's Italian. I could be an
Yeah,
Italian.
you could. Definitely.
I feel like Spain, I'd be fine.
yeah.
you.
Portugal,
Middle East,
Middle East.
Middle East.
no problem.
Yep.
Oh my
India.
God.
I've gotten even Indian.
I have got some interesting ones.
Yeah.
Yeah.
I bet. I got some big stuff to ask you
Okay.
here. So,
Let's go.
are there vets for fish or
Yes.
marine?
Yes.
So, how does that work? They show up with like a bowl of water and their pet inside of it? Like I had a beta fish. Do I show up and say, hey, I just want you to check on my fish? Or nobody's doing that?
And his name, what was his name?
Skinny Peacock.
Skinny Peak, and his name's Skinny
My
Peacock.
son named him. My son named him. He was skinny and colorful.
Oh my God. So here in Columbia, your best bet will be to go to Sunset Animal Clinic. They see some exotics.
But how do you transfer?
So you will give all the information that you have. Hey, I noticed that.
So it's just talk. You just
yes,
talk.
you just
don't
talk,
bring
and
the
then they will decide how to approach that.
Okay.
But most of the people that work, let's say with marine, whales, dolphins,
Yes.
sharks,
Like at the zoo. I'm
any
thinking of
that.
the zoo,
Yeah.
too, like-
So you have to have all those internships, externship, and residency, and it's a lot of years of
I was
experience.
gonna say. And that's still in the veterinarian world, right? It's not like what's like a zoologist?
There is zoologists.
Is that can they do what you do or what vets do?
It's kind of like believe it's kind of like a fine line, or that line between what a doctor and now a nurse, a nurse practitioner
Yep.
can do,
Yep,
and
or
what can they,
physicians
or
if-
physicians,
Yeah.
what can they prescribe and not prescribe, procedures that they can do or cannot do.
So like if so let's just even go like a giraffe has a
Yeah.
neck injury.
Yeah,
What-
I saw one in
Or a rhino. Like I'm
A
thinking
rhino has a horn injury.
like I'm thinking
Yes. So, for example, University of Florida have a good program of zoo medicine. And while I was there, I took blood from a giraffe, a tiger.
Yeah.
It was an MRI was done.
How long was that needle for the giraffe? Like,
No, because
what's it?
believe it,
what is that? 4 feet?
no, it's not for me. So I was up in a ladder.
Yeah.
So there's a big chute. Okay, kind of like, do you guys remember? You have been to the zoo
Yeah.
here. Okay, so you remember where we used to have the elephants?
Yep.
That there's those big chute areas that they can go in.
Yeah.
So it will be like that. It will be mildly sedated sometimes, sometimes not. Sometimes it's just distracted with food, and you go and access the neck and get your blood, for example.
So you're going
there.
at the neck to get the blood.
Yes.
In a tiger.
So that will be different.
How?
Not
There's
a
some
tiger,
there's
giraffe.
some animals that you can do it while they're awake. Other animals, especially wildlife, you have to do all of this when they're sedated.
Yeah.
Totally sedated.
Right. How do you find the vein?
You learn that.
You just
You learn
jump.
your anatomy, and but just like us,
Yeah.
we have the big
Right.
jugulars, right?
going
So
in
that
there.
is a very good source
Holy
of it.
cow.
There's others. There is, for example, in cows, and I did a lot like under the tail. You go in the back, you raise the tail, and you get a blood sample from
In the
there.
like in
Yeah.
the tail.
So here's
You're
here's
right
the
by the-
tail. It's just like right there, running under.
That had to be like that had to reek.
It's kind of like you guys have. No,
I was
you
just
get
think of
used to
how
all of those
smelly-
smells.
Oh my
all of those
God.
scents, you get so used to it.
Ugh.
It's like it doesn't touch you no more.
Now,
No.
back to your dating life then. Do you
Oh
ever
my
get worried?
God, that was like going straight.
Here's the
U-turn.
there was
No,
a good
that was a
transition.
natural transition.
Yeah, natural. So because your sense of smell is like used to that,
Mm-hmm.
do you ever get worried? Like, what if you smell like these pets that are just, ugh. Now you always generally smell good, right? Like, do you make? I know I'm going down like my brain's going
Do
a mile
I
a minute.
regularly smell good?
I
think
just
smell good.
Yeah, I've never smelled anything.
no,
not
yeah,
good on
no,
you.
you.
I think
That's
I
the
smell
But
thing.
just in general, like
If
pet,
you're-
like you're saying, like a
like
dog
a pet
owner doesn't
or a
know how
smoker.
bad
Let's
their
use
house
smoker.
smells.
Oh.
Yes, they get used to these smells, and it's
Yes.
like I smell that you just had a cigarette 2 hours ago, even though you chewed gum and sprayed your car. Does like a date be like, I know you just lifted a cow's tail and injected it? In other words, do you worry about that, or do you take precautions to make sure your sense of smell is not that tainted?
Well, my sense of smell is pretty.
Like it's still bad to you, right? Where you're like, that's
No,
bad.
I can't. I can sense a lot that other people is like, what? And I'm like,
Yeah.
didn't you smell that in that room? Body odor, cigarette,
Right.
weed,
Yep.
and others. Yes, I can smell all of that. Yeah.
And you don't get sick at all. Like you smell it and you're like,
There's some people that will get sick.
Yeah.
I don't. I
and
don't.
you're good with
But
blood and
there-
guts and all that.
Yeah, but there's sometimes there's some clinics that they have an exhaust fan. You can turn it on before you go in and everything. So it helps some. But there is some pets that will smell like a cigarette. They will smell like weed. They will
pets?
smell
Yeah.
pet.
Yeah.
They will smell like body odor. They
Yeah.
will smell like they have not been bathed ever, and they're 14.
How often should you wash your pet?
So you should not wash them because it's not a car, but they should be bathed.
You take them to the car wash, you just hose them down.
You should bathe them once a month.
Okay.
Or so. Take for granted. If you have your Yorkie and your Chihuahua that goes out just to pee and poop and comes back in,
Right.
is it really getting that dirty? Does it need to? So, you have some room to adjust that in your time frame
Yeah.
of how often
Okay.
or not. But generally speaking, anything from 4 to 6 weeks should be okay.
And then while we're on smell,
Mm-hmm.
why are animals smelling each other's butts?
So
Like, what's the
that's a
deal
good
with that?
question.
Yeah.
So
Is that their way of talking, like communicating or
there's
learning?
some
Or
kind of it's behavior, all right, and it's also to know is their own smell. Like, who are you?
so they're trying to differentiate. Like, is this a family member? What'd you eat last night?
Are you part of the pack or
Right.
not? So you have the anus, right?
Yeah.
Inside the anus, there's 2 glands, and they're called anal glands. Have you heard
Yep.
that? Okay.
Yep.
So anal glands are
Randy's very familiar with them.
I think natural flavors, and I don't know if this is true, but I've been
Flavors.
told that, like, you know how sometimes you see in a I might be spreading something
Okay,
that's
come
not
on,
true,
come
but
on,
I've been
give
told
me.
this
Yeah.
before. They said that when you see natural flavors in a
Ingredient.
food or ingredient list, that sometimes it comes from the anal glands of beavers because they have some sort of chemical in it that they use to stabilize it or make it taste good. Or
Is that real?
I'm gonna have to Google that.
You're
But
the
I was
expert.
I had someone tell me that, and
Oh my
ever
God.
since then I've never looked it up or spoken of it again.
But he loves natural.
But
anything
now that
flavored.
now that every time I see natural flavors, I'm like, no way.
that goes along with last week. I have this client, and he said, "Doctor, this is not a question coming from me. This was my wife." And I'm like, "Oh, you're throwing her under the bus
That's how
here."
you
And
know
he's
it's
like,
from him.
"No,
Yeah.
I swear it was my wife." And I'm like, "What's the question?" And he goes, "She told me that somebody told her that if you express the anal glands of your dog regularly, they will have no dental issues." And I just laughed so hard. I couldn't control it.
man.
I was just, and he's like, "I knew it. I knew
That's
it was
wild.
false. I knew it was false."
So
and
she's
I'm like,
been making him express these glands this
I
whole
was just,
time.
and he's like, "It's not true." And I'm like, "It is not true,
Oh my
not
gosh.
whatsoever. If that was the case, we will be expressing the anal glands of every single dog and cat."
Lord.
No.
You just saved that guy from a lot of misery.
Oh,
All right, so I interrupted though about the
Okay.
anal glands, but keep going on that.
So the anal glands are the ones that produce this scent, and it's specific for each animal.
like dog specific or like
No.
type of dog?
No,
Like just
like you can have let's say six golden retrievers from the same litter. Each one has its own scent.
gotcha.
And so when they have a bowel movement, usually the anal glands will get expressed here and there, right?
Okay.
And it will, let's say, like impregnate that odor or
Yeah.
that scent to the feces that is particular of him.
Is that part of like why they urinate on like marking their territory? What's the deal? Is that the same sort of thing? Or
so-
is that like just setting a trail to like get your way back home?
So the anal glands is more like, this is just me. This is, my feces and everything. The marking the territory is different. It's exactly that. I'm marking like
This
this
is
is
mine.
my territory,
Yeah.
or this is where I live,
Yep.
right?
Do most animals do that, or is that kind of unique to dogs?
No, mammals,
Mammals?
in general.
Because I saw Randy doing that. I wasn't sure.
I was just
that-
thinking that there's no urge to do that in humans, I don't think. Like, right? Like, I can't think of any human who's been like, oh, I'm going to go.
I
You-
will say that I think I have heard of some humans will do
Humans
that.
We'll
are
do
doing
that to
weird
mark their
stuff.
territory?
Yeah, oh yeah. They're peeing on each other. these days.
Actually, I
each
think
other.
Yeah, that's a thing.
well, if you are let's say at the beach, and you get stung by a jellyfish, and especially,
is that
what is
true?
it, the Portuguese? Oh, yes. It provides some relief if
Okay.
you get pee on.
Wow.
Oh, yes.
Okay.
My friend, we were surfing. She got stung for one, like neck, arm here, the back, and wrap around her right leg.
No way.
She was miserable.
And you peed all over her.
I did not. She didn't want nobody
didn't
peeing
want
on.
to-
I
You
told her,
offered,
I
though.
was
You
like, Sarah, he has to pee on you. I mean, you guys, it's easier than
Yeah.
me. Okay. And she's like, no, I don't want that. So
She just suffered.
yeah, she suffered.
All right, fair.
That's it.
All right. How clean are the tongues of animals?
No clean.
Not clean, right?
No.
So these
It's full-
people,
the mouth is full of bacteria.
these
So
people
you're
are
gonna-
tonguing their dogs. I've
Yes,
seen this. It's disgusting.
I do not understand that.
Okay, good.
Do not. No, there's absolutely
Like
no
licking their
reason.
face and
don't get
everything.
me wrong. There's some dogs really cute and everything, and they come and lick here or there. I finish and then I go and clean myself. But I do not allow no dog, no cat to
Yeah.
lick my face or anything like that. The mouth is full of bacteria.
Right.
They can even, for example, they have an open wound, let's say in their paw, and they lick. It's part of their behavior.
Yeah.
They think that they are, helping themselves, but they are introducing a lot of bacteria to that area.
So
lot.
with that behavior, like I guess, and mainly cats, they just lick everywhere, and I'm guessing
That's part
that's
of
like
grooming.
that's cleaning.
That's cleaning themselves.
When they lick their private parts, though, is that still a part of the cleaning
Yeah,
process,
that's
or is
part
there?
of the grooming process.
Really?
And for example, when a dog or a cat has a litter, right?
Yeah.
Mom will be licking their privates to stimulate them. And it's
To
actually
go.
needed to go and have a bowel movement or urination.
I've
Yes.
heard that with deer.
I-
Do you remember Stephanie's husband? What's his name?
Yeah, Kyle.
Kyle. He was like
Oh, he had
Hunter?
a,
He's
he had
a
a baby.
hunter?
like a baby,
Found a baby
yeah,
deer.
that was separated from the mom, and they took it in, and he had to,
To do it.
that's a real
Yeah.
thing. Oh my god,
That was,
Yeah.
yeah.
farmers know a lot of stuff, right?
Yeah, and sometimes that's why I think it's this is my personal opinion based on my experience. I think any veterinarian that finished vet school should go either on an internship or externship just to have more hands-on and experience. It will only help you. It will not do anything negative to your career or to you as a human being. It will be just better. So they can have all these experiences, because it's not until you are in a farm and let's say major help is an hour, 2
Yeah.
hours away, that you become creative. You become a person that can think out of the box. You can improvise. You MacGyver a lot of stuff, and it still can work. And you still can be helping this pet or this animal until, further or more proper care or
Yeah, that makes sense.
hospitalization or whatever might be needed after that.
Yeah. So this is a different direction, but I want to ask my neutering question now.
Yes.
Oh, we're finally there.
Because I've been thinking about it for so long, and it just makes no sense to me that a human can go get a vasectomy.
Yes.
And they still have their testicles
Yes.
fully intact. But you take a dog to the vet, they're not getting a vasectomy. They're getting all their parts taken off.
Ballectomy.
They get in, they're in testicles.
But you could, in theory, just
You could.
give them a vasectomy and not
You
have to
could.
take their testicles.
Yes.
But why wouldn't you leave them there?
It's probably easier just to whack the
It's
whole thing.
just, so to answer your question, can it be done? It could be done.
Does anybody do it? Have you seen it?
I have not seen
No.
it. I will not doubt it that there's many veterinarians that are currently doing it. But in terms of you want to neuter to a couple of things. So to prevent reproduction, right, for taking place, unwanted pregnancies, decrease the population of abandoned, pets on the streets and overpopulation and all of that, right? But also you want to neuter them to decrease chances of diseases, different diseases. And one of the top is cancer, testicular cancer, prostatic cancers, and others. So the easiest and fastest way to do it is just to remove the entire testicle. For example, I'm doing a neuter in, let's say, your Yorkie and Chihuahua. That might take me 3-4 minutes.
Really?
Yes.
Dang.
I could see. Yeah, I could see.
I
you
mean,
just
a
numb it up.
German Shepherd, let's say 90-pound German Shepherd, they're bigger and everything, so it might be more. It might be, I don't know, 15 minutes.
Dang. So you just sedate them?
It totally under dog neuters. I always have done them under general anesthesia, so they're intubated like a person, and they're connected to gas anesthetic.
Yep. That's one.
but not cats.
Cats male cats are different. It can be even faster than 3 minutes. It's just like nothing.
I worked on a pig farm when I was 16. I thought I might want to be a pig
So you
farmer.
know how they do it
So
with pigs.
there'd be there'd be litters all the time, and the farmer would be like, "All right, grab that pig and hold its hind legs over the end," and they would just neuter 20
Yes.
pigs.
Usually-
While they're with no medications or nothing?
They're
No.
just tiny little pigs,
No.
and he would
What?
just have a knife, and it would be like boom,
Yes.
and he
You
would
just
pull them
put
out,
them-
throw them, and the barn cats would eat them.
I learned it.
God.
Yes,
It
that
was-
is true.
That's how it works, and
That
it was
is true.
it was
What kind of world are we living
traumatizing.
in?
Yeah. I learned it like put it under your, well, I'm right-handed, so put it under your armpit kind of thing, and then it's just like hold those back legs and
Yep. And
keep
then just
going.
yank 'em out
and, then
and
you
throw
keep
'em.
going.
Wow.
Remember, it's like 17 piglets.
Right. There's so many of them.
There's so many,
And it's so fat.
and
It
you
was
have
literally-
to keep
yeah.
going.
But even to have the pigs, he would have to stick his arm, like I remember the first time I was sitting there, and he's like, "Oh, this sow needs to get these piglets out," and he was shoulder deep in
Grabbing
this sow,
pigs out of it?
pulling pigs out shoulder deep.
Oh my God.
I never did it, but I was there like catching them and rounding them up and whatever else.
How do you not see that and are scarred for life?
It's
I would be vomiting and oh my God. Like I can't even talking about it, like my stomach hurts.
the weirdest thing for me was the cats eating them. That was the grossest part.
Correct. That is, I agree with you. That's more gross than actually
Doing
that.
it. Yeah.
Yes.
Because by the time you've done 17 or
And
20
you
or
might,
30,
and Tom, you might be like, oh yeah, I cannot. But if we take you there and you are, I bet you that he will
I'd be in
fine.
a full hazmat suit.
I
There
don't
wouldn't
know
be
if you would. I don't know
a
if you could
centimeter
even
of my
mask.
body exposed at all during it. I'd have everything covered, mask, goggles, the whole nine. Now, I was wondering this. How different are the anatomies of all these different animals? Are they very similar? Like, because I feel like you'd have to know a lot.
Yes. So during your 4 years of vet school, primarily you learn your anatomy of your dog, your cat, your horse, your cow. So cows
The
are
things people care about.
the most common. Let's
Okay.
put it that way, right?
Nice way to say it.
Kind of like cows are under the category of ruminants,
Yeah.
right? Because they have different digestive system and many other differences, but you learn like your basics, and then as you do externship or as you learn more, you can specify into different animals, like birds and
Oh,
like
yeah, birds.
reptiles.
I forgot about birds.
Reptiles.
You take care of birds?
I do very easy things, like for
Okay.
example, beak trimming
Nails,
nails, the feathers. That's the thing. That's
You're not
it.
doing colonoscopies on a bird. Do animals do that? At all?
Yes, we
Oh,
do.
really?
We have
Okay.
ultrasound, we have endoscopy, all of that. We do CT scans, MRIs, all of that is available here in Columbia.
Gotcha. So you can categorize them and understand the main parts of the anatomy. I think we were thinking because for the wiener dog, we were like, there's got to be some different things in there, or is it similar?
So, for example, a wiener and a what?
Say that again. A wiener?
A wiener and a what?
You know what? We are not going here with pronunciation and accent. Where's the door? I'm leaving.
But yeah, Anna didn't know the answer. That's why we're like, well, we got to ask a vet.
It's just they're just short legs, right?
Their
exactly the same.
anatomy
They
is
just have
different.
short
It's
legs.
just like you used to have a what? A Boston?
Boston Terrier. Yeah.
Okay, flat.
Yes.
Yeah.
Right? And then you have your collie.
Long
It's
nose.
it's
Yep.
just different. It's just like, if you think about it, it's kind of like us humans. Some of us are very fine nose, others are broader, right? Others the nose,
Yeah,
the
the
bridge,
bridge,
it extends longer. Others is shorter.
Right.
It's just different.
that.
So different, yes, in dogs, different legs. Is primarily conformation and anatomical differences in terms of shape of bone, length of it. But in terms of their anatomy, everything is pretty much the same. However, then there's diseases that will be different between
Right.
them.
The different species.
Just like in humans, there's more diseases that can affect, let's say, people that are Caucasian.
Caucasian, yeah.
Thank you. Or people that are African Americans. So it's just
Or male, female, or any
male
yeah.
versus female. Correct.
that makes sense.
Or if you are older or younger, like for example, hypothyroidism in dogs is more common when they are after 7, 8 years of age, not when you are 2 or 3.
That makes
And
So
if
what's-
you're a female or spay or not, and different things.
What's the weirdest medication that you've seen for pets or animals, or or you think they're all pretty normal? Like I tend to think like mental
Like what?
health medications for pets seems strange to me.
And that's a new kind of, I call it kind of like a new category.
Yeah, like anxiety medication
Yes, there
for
is
a dog.
anxiety medication. So things that we use in people like Xanax, your Prozac,
Yeah.
all of that,
It's just
we use them.
shuffle it right over.
We use them in certain patients.
Do you run into any owners that are taking their pets medication?
I have personally ran into owners that I suspect.
Really? Like, what's the hot thing? And I don't know if we want to. Do
Gotta
we
be
want to share it?
Painkillers for sure, right?
Painkillers, yes.
Yeah. Okay. I was wondering if
You
like
guys
what's
know
the?
about trazodone. Have you heard trazodone used in people? Tramadol.
Oh yeah.
Yes.
Those ones are there was
Is that a muscle relaxant or is that a
tramadol is a pain. It's for
Pain?
pain.
Okay.
And the reality is that research have shown that not every single dog will respond to it. So for example, when I haven't used it in a couple of years now because there more research is like we don't know which dog is going to have all the enzymes necessary to get this drug to the metabolites that are the active form in order to work. So I stopped using it and use others. But yes, and then you have the owner that is like, why you need a refill already? I gave you enough for 30
Right.
days. What happened here?
And they're just popping them. What? I got a couple rapid fire questions. What's your favorite animal to work on?
I still will say the horse.
Really? Certain
one of
any
my-
type of horse, or just
I particularly like warm bloods
okay?
more than anything. So
Favorite procedure to do? Neutering.
favorite procedure. That's kind of gratifying sometimes.
Is
It's
it?
like,
Had a bad date last night. Time for schedule a couple of neutering. All right.
but I don't know. I don't think I have like a favorite. Well, let me tell you this. Boston Terrier, right? Sometimes they can have what is called stenotic nares. So their nose is just like a line. So we can do, it's a cosmetic procedure where we kind of open and there's we create a little bit more space for airflow.
Yeah.
So that is very gratifying. Me personally, because I like to be kind of very specific, and I like all my surgeries to be very cosmetic. I don't like to leave, come back for staples or suture removal in 10, 12 days. No, I want you to go and it will look like nothing happened there. So that's very gratifying for me.
And then how many appointments a day do you see? Like what's
So once again, it depends where you're working,
Yeah.
but normal, it could be anything from 13 to 17.
Okay. Mm-hmm. And then is there plastic surgery for dogs? Like if you want to give your dog implants, breast implants.
Well, you spoke about neutering.
Yeah.
There's a lot of guys, I'm sorry guys, but it is you, a lot of male owners that, okay, I agree to get my pet neuter, but
And then attach a fake set? Mm-hmm. No way. And you can make them as big as you want.
I have never done it. I know it's done, but there is prosthetic.
It's crazy.
Prosthetic
Just give them a
testicles.
vasectomy.
But what if you want the balls to be bigger?
So it's just
Well, you could do like an injector, like
No,
like lip filler or something. And then,
But you could attach a set of whatever you want on
yeah.
there.
no. These are things. It's kind of like a prosthetic. It is things that you
So they do
put, yes, and put it instead, and yes.
Okay. What's the hardest part about being a vet? Like, is it emotional? I feel like the
It is, and some days more than others, or weeks more
Yeah.
than others. So I wish, or anybody that is a veterinary student right now, I wish, and somebody would have told me that, yes, we made an oath of, and in reality, I'm here to help your dog, not you.
right.
Is your dog. However, you're the caretaker of the pet, so therefore it's kind of like a package deal, right? But there has to be a work-life balance, because in order for me to give myself, or let me rephrase that. In order for me to give the best of me to you as an owner and to your pet, I have to be okay, right? So if it's kind of like the oxygen in the airplane.
Put the mask on yourself first, then
First,
put
you
it on
take
your
first
kids.
care of you, so then I can help everybody else, right? At the beginning of my career, I was working 6-7 days a week. I mean, when I was doing my internship, I was on call within a month, a crazy amount of hours and
Yeah.
days. And I felt like I aged, I don't know how many
Stressful,
years,
yeah.
right? But a lot of students, it's just like they don't know that, yes, you should make that oath, and you do your oath and everything and work, but you have to take care of you, so then you can help
Right.
everybody else.
Because
That kind of, because I was going to ask you about your
Mm-hmm.
chiropractic story too, and kind of what got you into it,
Mm-hmm.
what your thoughts are on it.
Yeah, and that's a great question. When I was in vet school in UF, or at UF, I did 2 rotations with acupuncture. So, and it was acupuncture. Once again, all of that can be done here in Colombia as well.
Mm-hmm.
Acupuncture for animals, and many have a lot of good outcome. Even acupuncture in horses and different animals. And then there is chiropractor
Oh, yeah.
for animals as well. So
that.
that's when I was like, oh my God. And that's when I was introduced, and I started myself to get acupuncture and to go to the chiropractor.
So you
like
saw
here.
animals getting
And I was
adjusted,
doing
and then
it
you
and
decided that
learning
you
it,
wanted
and
to
I
do
was
that.
like,
cool.
oh my God, yeah. So I saw it firsthand on animals before, like on myself.
Cool. Yeah.
So that was how I got into liking all of
And
that.
you've been doing it for how long, or what's your, what was your progression as you went? Like, how did you find a chiropractor? What did that look like? I guess for yourself,
For
and then
myself,
maybe for animals too.
So here in Colombia, there's more than one place that will provide those services. For pets. For myself, I was just like, okay, which one? I mean, there's so many options, and I found you guys on Instagram.
Boom.
Oh, perfect.
And then I was like, you know what? I'm going to give them a call. And that's it. That's how it started. And then I saw the benefits. And, you know, to this day, it is so funny because you guys know that one of the exercises that you guys taught me at the beginning was to, like, do your chin back like this. And so especially when I'm on my drive to the beach to surf, it's a 2-hour drive. I make sure that kind of like I don't have any cars coming and I'm driving and I'm doing my exercises and I'm like, okay, and my stretching and everything, getting ready. So when I get there, it's just get the board and get in.
Love that.
And then last question, what animal would you be if you could be an animal?
If I could be.
Yes.
Nobody have ever asked me that. Oh my God. I don't know.
You got to think, do you want to fly like a bird? Do you want to swim like a dolphin?
I think I will swim. And yes, a dolphin.
Dolphins
will
are
be.
good. I mean, that's what I was thinking. I was like, yeah, you want to be fun too. Like I feel like
they're on
It
dolphin.
feels like they're smart.
yep.
They have
Everybody likes them.
freedom.
Yeah.
I mean, don't get me wrong. They hit you. They can break.
they can fight back, yeah.
They can break a rib or something. Last weekend I was surfing, and this is the first time they have been the closest. So yeah, kind of like about where you are. I'm like, okay, I like you and
No
everything,
way.
but don't come my way.
Wow.
So yeah.
And then what do you like to do for fun in Columbia besides hang out at Savage?
Yes. Besides Savage, oh my God, here in Columbia, you know what? I don't do much
Really?
here in Columbia.
Just kind of work and
You go surfing
home.
every week to
I try
Charleston
to go
or wherever.
surfing every week, every time that there's waves. Yeah, I go there. I work out 4 or 5 times a week in the morning, 5:30.
What are you doing?
I do body weight workouts, and of course,
Like at home?
Yeah.
Yeah,
mhm.
nice.
And then, of course, some weights and bands and that kind of stuff. I used to do jiu-jitsu, Brazilian jiu-jitsu,
kidding.
but then I got my shoulder injury. And since December, I have not been back to it.
When I got my teeth knocked out playing hockey, I quit hockey for 5 years.
There you go. That's how
I
I
get
feel
it. I
because
understand.
it's
I
just
understand it.
so demanding, and I'm not going to be like sparing with you. And I'm like, oh, but by the way, be careful
mean,
with
yeah.
be careful with my shoulder. I'm like, no, or I will be protecting it. And I'm like, no.
Yep.
So
And then how do people find you if they want to work with you or use you or get their pet checked out? You want them to slide into your Tinder profile or?
I do not have a Tinder profile. Thank you very much.
Sorry, Match.com.
Not anymore.
All right, sorry. Go ahead.
Not anymore.
Do you have a website or?
No, I do not.
Oh, no?
Because the practices are the ones that will have to call me. And, and kind of like, it's not anything that an owner can reach to me.
If somebody wanted a
Correct.
at-home thing, though,
Yes.
could they reach out to you? And,
I
like a
guess
home call
so.
or
Yes, a home call, but the most that I can provide is just an examination and give them like pointers or kind of guide them. Okay, this is what you should do,
Sure.
or you should go then to a hospital, and these are things that can be done for your pet. That kind of thing.
That's good.
Nice.
All right. Well, thank you for being on. This
Thanks
was
for being
great.
on.
Yes.
We're here for the health of it.
For the health of it.